The community of Ahousaht is reeling after 2 more recent opioid-related deaths, and family members are in Port Alberni today as the Nuu-chah-nulth Tribal Council issues a state of emergency.
We're not going to tolerate these types of losses any longer. We need to stand together, and we need to hold our families up, and we need to learn from these hard-learned lessons and the lives that have been taken too soon.
The NTC, which represents 14 Indigenous communities on the West Island, is demanding change and help from the province.
What is being done isn't enough. We know that. We don't have enough capacity and dollars. Certainly we provide services at the Tribal Council, but it's not enough. Our workers are overworked. There is just too much to deal with.
First Nations people make up less than 4% of BC's population, but almost 20% of toxic drug deaths in BC. They say these communities need adequate funding and resources to provide help and proper health care to their people.
To be able to devise our own solutions, lead our own strategies on mental health, on toxic drugs, we need to have this before we lose any more people.
She couldn't say how many people have died, but did say Port Alberni is second only to Vancouver's downtown east side for the number of deaths in BC. And today in Vancouver, Premier Eby says he's saddened by the news and will support the Nuu-chah-nulth people.
Nuu-chah-nulth First Nation is grieving right now, and we will provide them with the support that they need around counseling and additional avenues of delivering care in their community for people who are struggling.
You know, we got to go to Ottawa. We got to start changing things. We have to start making noise about the legal system.
Community members are calling for more power for the RCMP and the justice system to deal with drug dealers, and say it's hard to keep drugs out of their communities.
So, on one hand, we need to be very assertive and aggressive when it comes to ensuring that this doesn't continue to happen. And on the other, we need to take a harm reduction approach where we put proper services and supports in place for those who require it so that we're not inadvertently causing more harm.
They're inviting federal and provincial leaders to their remote communities to see firsthand what is happening.